So in Australia, I think the most common presentation will be usually worrying about a certain lesion or spot. So they've noticed something come up, or they've had a friend, family member or relative that's had a skin cancer, and that scares them. Obviously, skin cancer is very prevalent in Australia. We have lots of sun, and we have a general inkling to be outdoors, particularly in the baby boomer generation as well. So the most common presentation would usually be for a skin cancer check in terms of dermatology. In GP practice, that's probably also very common, but then a lot of presentations are about different rashes as well. So when we see a rash, we have to work out whether it's an inflammatory rash or whether it's an infective rash, or if there's something else systemically going on. So the skin is also a window into what else is going on in the body. So there's a lot of systemic diseases that can present in the skin. So we've got to think sometimes outside the square in terms of what are we seeing on the skin and what that could represent otherwise. One of the other common presenting complaints is itch. And then you've got to work out whether it's itch with a rash or itch without a rash. And if there's itch without a rash, that's much more difficult to deal with, and we've got to exclude things like paraneoplastic phenomenon and do a lot of investigations. So that's actually much more difficult to treat because inflammatory skin rashes, we can usually use some form of anti-inflammatory or immunomodulator to settle things down. So one is actually paraneoplastic phenomenon. So that can present with lots of different rashes in the skin, whether it's generalized itch, generalized eczematous eruption, erythroderma, where 90% of the body surface area is covered by red skin. So when we look at different rashes, we consider, could this be related to an underlying malignancy? In terms of other systemic things, we have conditions such as dermatomyositis, which is inflammation of the skin and muscle, which again 50% is linked with a visceral malignancy. There's conditions such as sarcoidosis, which can present in the skin and can be multi-system, affecting multiple organs. And there's a lot of autoimmune conditions such as lupus, scleroderma, that can not only present in the skin or have presenting symptoms or signs in the skin, but can affect things internally as well. So we have to ask for those symptoms and then also refer them on for necessary investigations or to other specialists to investigate those things.